coffee around here somewhere. Well, let's see if anybody's up. Anybody up? Anybody up? Anybody up? Wanna learn some stuff today? Yes, it's Saturday. It's yucky weather here in Washington, D.C. I was about to run. I said, no, I'll do this first. Then I'll go run. Maybe it'll be a little warmer in about an hour or so. So that's what I'll go out and run. And by the way, before I cover the topics I want to cover today, it won't be a long one, but I got an email. And anybody wants to email, I'm at letsgofreeradio@gmail.com. And somebody, a young woman was offended, I think, of something I said yesterday, the day before, about them being in the jewelry business. I don't remember what the heck I said, but I could imagine I offend a lot of people. But you know, but one thing to remember, that anybody tells you what to do with their life, with your life, you know, just ignore them. They don't know. We all don't know what to do with our own life. So if you think I'm really telling you what to do with your life, man, I have no idea what you do to life, because I don't know what to do with my own life. You know, and we all struggle with that. And all I'm trying to do is present options to you on what to do with your life. I mean, I think maybe she said something about a jewelry, and I may have said, you know, if you get and she's selling jewelry on the internet, and I can't blame that or say anything's wrong. What I think is wrong about selling on the internet, when you pay somebody hundreds or thousands of dollars, you know, to learn how to sell on the internet. Now that's it. You're going out and sourcing your stuff and doing it all yourself. Well, that's cool. You know, I mean, I don't know. So I'm not sure what I said, but I, you know, I admit it if I did and apologize. But more importantly, you know, whether it's me or anybody else tells you what to do in life or what's right for you, they don't know. And you got to listen to your heart. Your heart is smarter than your brain or any other idiot like me who tries to tell you what to do in life. Because we don't know. We're all struggling, and what we're here is to help each other, you know, with the struggle. You know, and that's what I hope I do. Show you extra sources of money and help, you know, to help with that struggle. Or whatever. I mean, I've been studying free money sources and help millionaires and all kinds of people, yeah, get free help to do what they want to do in life. And that's what it is. I certainly have my opinions on what I want to do in life or trying to do, and it doesn't work out a lot of times. And so that's why we all have to fail to get there. Shantae, Saturday morning for... Oh, wonderful, my favorite DC realtor. Well, man, real estate's booming in DC. At least that's the feeling I get. That's going on now. But let me cover a few items, you know, that I found in the press recently, and that, you know, we all should know about. I mean, what's happening? I mean, Trump is playing around with medical care, and then of course, the Obamacare isn't the perfect thing either, and certainly needs work, but it certainly brought millions and millions of people into health care that didn't have it. Now, what he did the last day or two, I want to talk about because it's important. He's cutting out the subsidies for low and middle income people to pay for co-pays or your deductibles, or you know, things like that. Now there's our cost sharing, you know, that cost sharing. So when you sign up for a healthcare plan, you know, you may have like a $5,000 deductible or whatever. You may have up to $13,000 deductible. I mean, that's a lot of money. So yeah, you might as well not even have healthcare, right? If you have that kind of deductible. And that's one problem with the existing system. But what he does, what the government, what in the law was that you get rebates if you make $60,000, about $60,000 or less, you will get a rebate on those deductibles. I mean, you will get paid. You know, you won't have to pay those deductibles, or they're sharing. So it's like the silver plan. I mean, it's a little complicated. You better talk to somebody who knows the system if you're signing it up, because, you know, it's important. And I'm going to tell you options a little bit, but what it's doing is, you know, the government was giving money to the insurance companies to to pay for, people of certain incomes to not have to pay the copay, to not have to pay the deductible, and things like that. So you really, for lower income people, get more health care, and really, health care to me is preventive health care. And so you have to really catch things fast and be regular with things like that, so you keep healthy, and not when an arm falls off, you go to see the doctor. That's what most of us do, I think. So this deductible, it meant about $3,500 to the person, to a lower income people. Lower income now, I'm talking about $60,000 a year. Now, to me, I used to think lower income was somebody like $10,000 or something like that. But no, it's $6,000. So this is the middle of the road kind of folks. So moderate income people. So they're losing that subsidy now, which usually ran up to about $3,500 a year. And what's amazing is that subsidy is $9 billion. Okay, so the government is giving, these people who make less than $60,000 a year, $3,000, $3,500 a year extra to pay for these co-pays and things like that, because that's a killer. And there's about 7 million people. So about 7 million people all of a sudden are going to wake up today and they're not going to get that $3,000, $500 for health care. And what amazes me, this is a guy who said he's going to take care of the average person. Well, 7 million of the average people just got screwed up, $3,500 for health care. That's how average that is, or that's how take. And then see, what bothers me is that Washington is working on a tax cut now. Okay, now here's what is in this tax cut they're trying to get through. Okay, after they cut $9 billion for people making $60,000 or less to pay for co-pays and deductibles and stuff like that, they have a tax bill now that is going to give a subsidy of, to people. They're going to give like what is it, like $140 billion a year. Okay, now we're talking $9 billion was in the health care. They're taking away $9 billion from people earning $60,000 or less. Now they're going to give $140 billion, not 9, $140 billion in tax cuts. Okay, who gets that $140 billion? Okay, half of that $140 billion goes to the top 1%. So that means people making almost $1 million a year or whatever, the top 1%, whatever the heck that is, I think maybe that's 800,000 or something like that, they're going to get a refund of they're going to get $130,000 from the government on average, and people making less than $60,000 are going to get $3,500 less. And the difference in the numbers to me are astounding. We're trying to save $9 billion from middle income people and give $240 billion, or actually $140 billion to the top 1%. See, this is what happens when you make money and you finagle the system. You change the law and make something legal. That's why, to me, okay, they're going to make it legal. But man, to me it sounds immoral. How could you morally do something like that? That certainly isn't the Jesus Christ tax reform bill and health care bill, right? There has to be moral implications and all that. And actually, what's interesting about the tax cut bill right now is that the tax cut bill is the top 1% are going to get 50% of all the benefits on the tax care bill. That's in year 1. By year 10, they get 80% of the benefits of the tax cut bill. So 80% of the tax cut bill is going to go to the top 1%. You know, these are big studies. I could show you the links. I mean, I did some research last night. It was, you know, bothering me, you know, kind of thing. And what I want to do, though, is show you about other ways to supplement that. Trump claims to be for the middle class. Yeah, well, I don't know what. Maybe to him, middle class is making only $1 million. Yeah, that's what I could think. Oh, of course he is. Yeah, and all his buddies are one of the millions too. So that's, you know, now what I want to do. Okay, now that's a political thing. They should get out and do whatever you want to do. You know, on that. But what I want to show you too are programs that are already there that can help you with that problem. Okay, see, and even before Obamacare started and brought 10 million, 20 million people, you know, to get health care, didn't have it before, and that's why we have the lowest rate now than ever. It's costing a lot, but that's another issue. We sort of don't talk about that. We should. But there are existing programs that people don't know about. Okay, for healthcare. Oh, and maybe in case we lose people, I'm going to tell you later too. I'll come up with how there's $1 billion. Listen, Google is giving $1 billion for you to get free training to be an IT expert in jobs. Now, so for you to get a good IT job, Google is going to spend $1 billion, $1 billion for you to get a good job and get IT training, free IT training to do that. And by the way, if I have 2 courses on Udemy, if you go to Udemy or go to lesco.com/course, Lesko, Lesko.com, course, C-O-U-R-S-E. I have 2 courses, one on job training and one on healthcare that shows all these things. So if you don't get enough out of this and you want to get in the weeds more and learn about it, I have it. But let's go over some of the places to get free health care, you know, particularly the people making $60,000 or less and are going to get screwed out of $3,500 for health care. Okay, well, one thing that people, if you go to pparx.org, pparx.org, okay, PP, you got to go PP, okay, I'll be right back, I'm going to go PP, okay, but you want to go pparx.org, you know, and you'll see there, that's where you can get, you could be making, oh, I don't know, $40,000, $50,000 a year and get your prescription drugs for free. This is a place where you could go and the drug companies, you know, have programs for people with limited income to get drugs. I mean, I've done surveys, undercover surveys and stuff like that of doctors. Doctors don't even know about these programs. They don't know. They're trying to pay their own bills and beating you on the head to make you pay their bills too. So they don't know. So pparx.org. So that's a place for that. Also, you know, here's a great thing, a website. You're looking for health care by people who get grants to provide health care services for free. This is dental, dental care, health care, anything. You want to see a proctologist, anything like that. Okay, here's where to go. See, the government gives grants already, another program, nothing to do with Obamacare. See, all this stuff has nothing to do with Obamacare, whatever they're trying to fight, you know, on Obamacare. Did I miss the information on Obamacare? I didn't get into the details of that yet, but I'm on healthcare. Somebody asked about the job training stuff. But I do have, if you miss it and have to run, don't forget, lesco.com/course. I have a Udemy course there about job training and all the free programs that are out there. Google is starting one now. I'll give you a little heads up. On the Google, they're giving, Google plans to donate $1 billion to nonprofits through its charitable arm, Google.org. Google.org, with the aim of addressing the gap between the skills required for modern companies and the skills that are taught in schools. Google said it is donating $10 million right now to Goodwill Industries, for example, for digital job training programs. Company employees also will volunteer 1 million hours at these nonprofits. See, what they're doing is giving nonprofit organizations money to train people to get job training skills. I'll cover this a little more later, but if you're looking for that, you could start with your local career one-stop center. You go to 211 and put job training. You're really looking for nonprofit organizations that have job training, and that's digging, and that you got to dig in there. You just can't make one Google search and it's going to no, they're not going to do that. That's why if you need help, I have the Udemy course. It's like $19. One on healthcare and one on job training. Udemy. I mean, if you put lesgo.com/course, or if you go to Udemy and just put Lesgo, you'll see all my courses there. But here, okay, back to healthcare. Okay, here's the website for finding a clinic that gets government grants to give you free healthcare or sliding scale healthcare. Okay, it's called Find a Health Center. findahealthcenter.hrsa. Let me get up. Okay, findahealthcenter.hrsa. Okay, so find a health center. Oh, we're back upside down here. Sorry, I forgot to change my thing. There we go. See? Isn't that cool? So find a health center and then .hrsa.gov, okay, and then you can put in your zip code or whatever and find health centers in your area where you live to get free or what they call sliding scale treatment. Because what they do is charge you depending on your income. Okay. Now, also, there's something else in the government that very few people know about. Hospitals won't tell you about it. This is a program that's been around for years and years called the Hill-Burton Act. Hill-Burton Act. Okay. And that means hospitals have to treat you for free. Okay. Hospitals have to treat you for free if you can't afford to pay the bill. And that's because at one time they got grant money from the government to improve their hospital or whatever, and so as a result of getting that, they said, hey, we'll treat a certain amount of people for free, okay? But they don't have signs telling you that, and you'll never know about that. And there are about 147 hospitals around the country that offer this free treatment. And again, they're not going to tell you about it. So if you, and that's also on the HRSA.gov. If you go HRSA again, .gov, and put in the Hill-Burton Act. So the Hill-Burton Act on HRSA.gov, and you'll start finding all those hospitals that that will treat you for free, depending on your income. Okay, and that's what's so amazing to me. I can imagine if you go in the hospital, wait in the waiting room, and you see a big sign there, "Free care, come and get it," whatever. Nah, you're never going to see that. And that's a problem. Okay, here's another place to get free health care. You can't afford the co-pays, you can't afford the what do you call it? The deposit, not the the stuff up front, the discount, the deductible. That's right, deductibles, co-pays. That's what's killing everybody. Deductibles and co-pay. Okay, go to NeedyMeds, NeedyMeds.org. See, you hear now, everything I'm telling you about is .org or .com. I mean .org or .gov. Screw the .coms. You can't afford your time right now unless you really know the system well to mess around with any .com. You just concentrate on going to .gov or .org, and that's a safe way. Sure, there are some good ones. I think I'm one, but you don't have enough power to deal with this yet. You have to find these things first because they're going to be free or a hell of a lot cheaper than any .com is. So that's Needy, NeedyMeds.org. And the thing you want to look for there is state programs. If you go to that website and see state programs, you will see a whole list of all kind of programs that are available in your state. And that's medical care, all kinds of stuff, that people don't know about. There will be free prescription drugs programs. There will be free programs for mammograms and cancer treatments and things like that. All kinds of things. Every state has different kind of things. So that's why you have to find out what's available in your state. So that's what you want to do. That's another, and that's needy, Needy, MEDS, .org. Okay, now, like breast cancer screening, children and youth, special health, early intervention program, health safety net. See, that's free care. Pays medically necessary services at centers and acute care hospitals. So they pay for your bills. But you have to know about it. Ask. Nobody's going to come, knock on your door. Hey, you want to get free medical treatment today? We have it here at the government. No, they don't have people selling. And they don't go on the internet and market that either, because nobody. Nobody gets paid. The people who find you, or you find on the internet, are people going to get money from you. That's their motive to find you, is they're going to get money from you. But the people who don't get money from you, they have no money to find you. So you have to find them. That's your job. Okay, now the other thing too, the first place I think you should start in any kind of health problem is really your county health office. Every county has a division of health. All kind of services are different in every county, so you don't know. So just call your county government. Will the tax cut include low-income people? Yes, but they're going to get about 6% of it. Somebody said, well, the tax cut. And guess who's getting all the rest? That's the trickle-down theory. That's why it's a sham. And that's why you get tax. I mean, you're low income. I mean, you're not going to get much. It's the people who are going to get eventually 80% of this tax cut, and that's just the richest 1%. That's astounding to me. No wonder they're motivated to try to do this tax cut. Every other thing they do is say, oh, we did this, we couldn't do it. Okay, let's do a tax cut. Okay, oh, we did this, no, couldn't do it. Well, let's do a tax cut. And they, oh yeah, it's for you. Here's a few shekels. Okay, so your local office, and I've interviewed these people, the local health offices. I mean, they're there to help direct you on what's available, whether they're paying for it through clinics or services or payments, for you to get health care, or know where they are in the world. Now, here's another thing people don't know about in healthcare, is you can get treatment by the best doctors in the world. That's right, the best doctors in the world, the ones that Donald Trump uses, right? So he could pay for anything, right? Most rich people that know the system well enough are going to go and get it from doctors that paid by the government. They get grants. Doctors are getting grants to treat you for free. I mean, the clinics do too. They get grants, but there's other doctors that, you have a condition that you can't solve, like you have pain you can't get rid of, or some other, condition that you go to doctor like I'm getting solved. Well, what we do, National Institutes of Health studies that. So they give doctors grant money to go get patients, treat them for free, and try to study this. So these are the best doctors in that condition that are getting grant money to try to treat you and learn from it. So you have access now, not to just the doctor down the street or whatever trying to treat this thing that isn't solved. You now have access to the best doctors, these people getting Nobel Peace Prizes and stuff like that, for their discoveries, right? Well, they're getting grants from the government, and what they do is getting grants to treat you or work on your condition. I mean, they're all studying little funny stuff. Like I was going to go, I'm missing a tooth, and my dentist wanted to charge me thousands and thousands and thousands, to get a dental implant. And I went there to this website. Here's the website, clinicaltrials.gov. Clinical, clinicaltrials.gov. Now there's a database of all the doctors who are getting grant money to it. So actually what happened is I found a doctor who was studying that and would do it for free because he needed the data and all that kind of thing. I don't have health concern, I need tumor removal. Okay, that's a place to check. You don't have health care insurance and need a tumor removed. check with clinical trials. Check all those other places I talked about too. You still have the, and anyway, so I got on the list. He's going to treat me for free, and I was so excited about it. I was doing Larry King. Anybody remember Larry King? If you're an old fart, you remember Larry King. I should do him all the time. I did it maybe, I don't know, 10, 12 times or something like that, because they'd call me when somebody canceled, because I lived in town, and they'd send them a limo and do, let's go, somebody canceled, can you come out tonight, in about 20 minutes, and I go and, sell a book or two, and actually Larry King made my career. The last time I was on the air with him, he looked at me and said, "Lesko, I made you an H. Ross Perot." Yeah, I did a book on H. Ross Perot too, all the government information about it. But anyway, I went on Larry King and talked about this, and this poor doctor, I'm giving the information, like I do here and all the kind of, and this poor doctor got 500 phone calls. People want that, and he kicked me off his list. So when you get this, even if it is a dental lawyer. So that's another place. That's clinicaltrials.com, okay? Okay, let's see, where else are good places to start? Free immunizations, okay? There's free immunizations at every county. You'll have free STD prevention and treatment, okay? STD, we don't want, this is a disease that's communicable. Other people could get it. So the government wants to treat you. You're worried about, you got some STD or whatever. It's all free and anonymous and whatever. Your local county, clinics will test you and treat you for free and give you free condoms too. So that's one thing. You may not be getting a big tax cut, but you're going to get free condoms. And I guess that will keep the masses quiet. We're giving them 8% of the tax cut, but you're going to get free condoms. What a deal! Come on down. So that's what's out there. Breast and cervical cancer treatment. So if you're a woman, 40 or more, I don't know the law anyway, they keep changing the studies, on when you should have breast cancer treatments and stuff like that. But there is a federal program in every county. You could get free breast cancer treatment, free breast and cervical cancer detection and treatment. Okay, so that's why aren't you on commercials? Because the commercials don't work anymore. Nobody buys reference books. So that's what I'm trying to figure out. And here's if you go to, let's see, what is it? nccd.cdc. That's the national database. NCC, what is that? Okay. Okay, and if you could read my chicken scratch, nccd.cdc.gov. Okay, nccd.cdc.gov. Okay, so that you go down now. That's the Center for Disease Control, and you put in. They'll probably have a search there. That's the acronym for the program. But you're looking. I'm sorry. Breast and cervical cancer detection and treatment. Breast and cervical cancer detection and treatment. That's what you want to know there. Okay. What's today? Saturday. I don't understand. Apply for free healthcare card. Okay, now they have, and also here's a wonderful nonprofit organization. There's a bunch of lists that I put in this. The course that I have on Udemy, and you can go to Udemy and put Lesko, or put lesko.com/course, and you'll get all the links and the information there. But here's one of the great nonprofits, I think, that are out there that help you with co-pays and stuff like that. Also fighting your insurance company, you can't get paid, and somebody who needed that treatment, a kidney or something, free IT training. Yeah, I'll cover that. If you go to, I would go here too to find how to get that if they have ideas on how to get that surgery paid for. But here it's called patientadvocate.org. Patient, P-A-T-I-E-N-T, advocate, A-D-V-O-C-A-T-E.org. You notice I'm reading that. I'm a terrible speller. I flunked English in college, even though I have a couple of New York Times bestsellers. I'm not too good at spelling. Never have been. Okay, so patientadvocate.org. Now, they're a nonprofit, fights for you. They have grant money to pay for co-pays. Is good for all class. Do you think Trump... somebody asked, do you think Trump care is good for all class people? I mean, from what he's showing now, no. Because if you missed the beginning of this, his announcement he just made yesterday is going to cut, is taking away $3,500 of co-pays from people making $60,000 or less, and that's 7 million people. So 7 million people woke up today and just got screwed out of $3,500 because of his whim. You know, I mean, it was in a law that's already passed, and everybody was getting it, and so now they're screwed. And so, you know, it doesn't sound fair to me. Particularly, he's working on another bill that's going to give $130,000 to people making millions of dollars. Now, why the hell are they getting $130,000? Somebody can't afford health care. You need that to live. Are getting screwed up. $3,500. We are not screwed. Maybe, maybe not. Who knows? It's a long life. And sometimes you win, sometimes you lose. Okay, so that's patient advocate. Here's another list of like free eye care. If you go to NIH, but it's NEI, National Institute of Health, NEI, and then .nih.gov. Okay, so that's NEI.nih.gov. So if you go here, okay, NEI.nih.gov, and then put in financial aid, okay, and then you'll see a listing. They have 30 places or more financial aid for people with eye conditions, getting prescription drugs, getting glasses, getting eye surgery, all this kind of stuff. And a couple things like that. There's another one here for cancer. So if you go to cancer.net, and you put in financial aid, and you'll see that. Okay, don't want to tie you up too much. That's the kind of stuff that there. I hope they help you. Let's go. Okay. And what I also want to do is make sure people know about that IT training. Okay, did I miss the information on IT? No, he does not want average people need. He always been upper echelon. Yeah. Let's see, I'm just reading some. Okay, just to, hey, love the videos. Any suggestions for newcomers? Yeah, look at the old videos. Or actually, you know, I have a service that's doing very well now. I need to get my A+. I'm not sure. It's called letsgo.com/talk. I have another one in about a half hour, so that's why I got to go and prepare. This is where we talk on the phone for usually 10, 20 minutes, and I could show you the links to solve your problem. We're the best sources. I mean, I can't guarantee anything. Nobody can. But I could show you the best links after studying this stuff 40 years where I think are the best sources of potential money to solve your problem or any kind of help. So I do that on the phone, letsgo.com/talk. Okay, a little more on the IT. This is a study, a report now about Google. Just yesterday came out and saying they're giving $1 billion for you to train in IT for free. So how do you find that $1 billion? Okay, where is that going? Okay, it's going to go to nonprofit organizations. Okay, how do you find that nonprofit organization? Right now, you could go to, they just gave $10 million to Goodwill Industries. So you could put Goodwill Industries. Right now, you call them, local Goodwill Industries, and say, hey, do you have any, did you get that Google money yet? You're going to train for IT. And actually, Goodwill Industries has other training programs. And this is free training. to get a better job. Okay, how do you find those free training grounds? That's hard. See, so many of the, locally, there's two places. You want to go to your local county career one-stop center. They may not have it. Remember, every place you contact is not going to work, and none of them, very few are, but you have to go through it all to find the ones that work. It's like every girl you see on the street is not going to go out with you. Every guy you meet is not going to go out with you. But if you don't ask, they're never going to go out, right? And you're going to sit home doing nothing. So it's the same with everything. These are potentials. All I could say, these people are single and available. Now, whether they go out with you or not, you got to find that out. And so anybody says no, here's the key. You say, where else can I contact? You don't say, oh shit, Let's Go was full of baloney, and you go home. No, you say, okay, where else? I mean, you want to solve a problem, it's going to take energy, and that's the key. And it's a numbers game. It's like doing anything in life. You got to ask 10 women at the bar to go out with you before maybe you get one. And I know it's all like that. I've written 100 books and only 10 have made money. So I know I'm wrong 90% of the time. And what I want to do is give you sources. Okay, here's another thing. Look at Amazon, another frequent target of Trump, said in January they're planning to hire 100,000 new employees over the next 18 months. 100,000 employees Amazon is going to hire. That's it. So how do you get that training? Okay, there's the course I have on Udemy. If you go letsgo.com/course, right, course, C-O-U-R-S-E, letsgo.com/course, C-O-U-R-S-E, takes you through how to find the local programs for training. I have it there for job training. I have one on health. So it takes you through step by step finding health care coverage, for dental care, for health care, even pet care, that I have in there. So all of that is there. You're doing it yourself. I give you all the sources to start looking at for yourself. Let's go Walmart. Yes, and they're probably going to hire people to drive. You have a car, you got a job. So many people. That's a booming industry for job. And see, those jobs like delivering stuff for people, it's all very flexible. You don't have to work every day. You don't have to work 8 hours. You just work whenever the hell you feel like it, if you feel like it. That's what's so neat about the gig economy. And you're your own boss, and you're deciding every day what the hell. Every day I'm on vacation. That's because I love my occupation. And that's the way to live. So get out and live like that and use the sources you can, my sources, somebody else's sources. I mean, the whole key in life is just not giving up. Nothing's going to happen to you if you don't try to make it happen. People aren't going to come to the door and say, hey, like Ed McMahon. You remember him? Ed McMahon comes with a big check. Yeah, that was full of baloney too. I mean, they were real checks, but they made billions of dollars, so it was easy for them to give out $100,000, whatever the hell they're giving out. Are you an old bottom? I don't know what the hell that means. Okay, guys, I'm going to take off. I got to do a talk, one-on-one talk. Letsgo.com/talk if you want me to talk separate. And I don't yell on the phone like that. No, this is just broadcast. This is my yelling season. Well, thank you, Nova. It's nice to. Now, I enjoy this, and that's why I want to help anybody else in life find out what they enjoy doing so they can give as much as possible, to the rest of us and make their life happy and improve other people's lives by spreading your talent, what is special about you, and spreading joy to the world, because we need that. It's too easy to be miserable and get caught up with miserable people. So we need more people who are around enjoying what they do. If you enjoy what you do, that's infectious. And then people are able to love you better, and you're able to love better. And I think that's what it's all about. How much love can you get? How much can you give before you die? See ya. I'll be here for 20 years.